Our healthcare system will benefit from all of these proposals and will further address the opioid epidemic, fighting back against the growing problem of teen vaping, lowering prescription drug costs, providing more oversight in nursing homes.
Healthcare and healthcare reliability and security are issues that are at the forefront in people's minds of important issues. And so I'm very, very pleased that as Senate Democrats, we're making it a priority to talk about so many different important healthcare issues.
There's been a steady increase in the overdose deaths among Connecticut residents, from 357 deaths in 2012 to 1,038 deaths in 2017. This particular legislation will require the Alcohol and Drug Policy Council to provide the Public Health Committee with specific recommendations that will assist in expanding the access to substance use disorder treatment services and detoxification. 3.6 million young people across our country reported using e-cigarettes. As the Senate chair of both the Public Health Committee and the Children's Committee, I believe it is imperative that we protect our children from what the Surgeon General has declared is an epidemic.
It's a matter of public health and public safety to make sure that our public utilities act like public utilities. And I've tried to distill what I think they can do better down to a couple of bills, one of which is minimum staffing. They dwindled their in-state workforce for line people who do a job that I know I would never want to do, and relied on mutual aid. And that mutual aid issue works well, but it's not good enough in the immediate aftermath of a storm. I think that we have a 72-hour make safe as part of their emergency response plan. And by having an adequate staff on the ground in Connecticut, they could make that considerably less than 72 hours. And those 72 hours are critical.
The president right now is supporting legal challenges to the ACA, including a Texas judge's decision to strike down the entire Affordable Care Act, including pre-existing condition coverage. And they're enacting policies at the federal level designed to raise health care premiums even further, hurting families and businesses across Connecticut and the nation. No matter what happens in Washington, states like Connecticut have to lead on health care reform. As I mentioned, at this very moment, we're holding a hearing on a whole bunch of bills upstairs. We are going to be holding many more hearings on this issue throughout the legislative session. What's on our plate? A bunch of things. We're tackling mental health and substance abuse parity, tackling problems associated with high deductible health plans, lowering health care costs through plans purchased through the health insurance exchange, reforming outrageous prescription drug prices to provide real relief to consumers. We have to tackle the cost of health care for small businesses and individuals by providing real choice, a genuine public option to purchase health care.
The bill would require nursing homes to disclose the actual number of direct care staff has provided to residents and make this information available to patient families in an accurate and understandable manner. In essence, it's a consumer protection bill. It's a right to know for those families who are looking for a place to put their loved ones. There are approximately around 22,800 residents in Connecticut currently in skilled nursing facilities, and many of them may not have families anymore. And so for them, the state is their protector, and we are the ward. So it's our responsibility to make sure that they're getting the best care possible.